There's a great comment that came in on my YouTube video. I want to address it now so that we can get this out into the public because I think it's an important thing to discuss. Many of you know that I'm a huge advocate for not pushing through the pain, for not increasing pain, for giving your body time to relax and recover. But this comment does address something that I didn't necessarily think about at the time, but I think we should talk about. Let me read the comment and then we'll get into it. You touched that area. The patient audibly portrayed pain. Why the heck would you continue to poke at it? You're like a visitor in a museum. You're trying to explain the painting and you touch it. And the museum staff says, don't touch the painting, sir. And you say, okay, but you put your finger on it for 3 seconds longer. Did you not hear the staff? Don't touch the painting. You're not special.
What are you doing? No touching.
No, I wasn't gonna touch it.
You're moving in with some ITT, bro.
ITT?
It's intent to touch, homie.
You can use other methods of description and highlighting when a patient says it hurts and what you're doing isn't meant to relieve the pain. Stop touching.
Put your hand on and touch it. Because I stand there and I wait all day for a little girl like you to come in and put her precious nail-polished nails all over the exhibit.
I totally get it. And this individual has every right to call me out on that. But what might not have been portrayed in the video, because it is a short video, I'll play it at the end of this clip, is I was trying to reduce the pain. Pain is one of those things that's highly context related. So if somebody is fearful, pain is going to be more increased. If somebody is stressed, if somebody's not sleeping well, the perception of pain is going to be increased. There's lots of things that will affect pain. If I do something and the immediate response is painful, I need to determine, is this just a gut reaction? Is this just a hypersensitive response that the more I do it, the less painful it becomes? And a lot of times with the total knee replacement or any kind of post-surgical case, that's what happens. Or is it something that's actually going on in the tissue, in which case the more I do something, the more painful it becomes? I also need to determine as a physical therapist, is this something that's dangerous? Is this something that could lead to further damage? Or is this something that's a pain experience that's not associated with risk of further injury? So in this video, I'm touching a sensitive area around the knee. I know the area that I'm touching. I know that it's relatively low risk of further injury, but I'm trying to make a determination. Is it sensitive and will respond positively to desensitization, meaning it's going to hurt less the more I touch it? Is it soft tissue? Do I think it's bone? Is this something that the patient would require imaging, like an x-ray, to determine if there's a bone fracture or something else going on? And in this particular case, I have a good relationship with the patient. There's a level of trust between the patient and I. Even though I and the patient know that this is painful, it's a less threatening situation, and it allows me to better examine the patient and understand what I think is going on so that we can reduce the sensitivity and resolve the problem. From a 20-second clip, 30-second clip, obviously there's no way for you to get all of that information, but I appreciate the comment and I appreciate the opportunity to educate and inform so that people understand I'm not just pushing it to cause more pain. I'm pushing it to diagnose and determine what is the best plan of action to reduce the pain and improve the function moving forward into the future. Stay on there, but take a break for a second. So when you think about the knee replacement, the main thing to understand is the tibia, which is this bone right here, the femur, underneath the kneecap, those components were replaced. When you're talking about pain and discomfort out here, out in this area, this bone here, this is the fibula. Okay, so that made you jump right there. That isn't part of the knee replacement. These are original parts. So